you to sleep. Do that to dogs. Where's McBurney's point? We just did it.
Not even half of your dogs.
Diet plans for patients who are anemic. Ooh, that was last week. Diet plans for patients who are anemic. Iron supplements. Easiest way to fix anemia, diet. Right? Red meats, good. Dark green leafy vegetables. Foods to avoid when somebody has GERD. Carbonated, okay, good. You remember that one. I like that. Huh? Caffeine, what else?
Alcohol.
Alcohol, good. Love it. All right, patients had belly surgery. How could I easily recognize that peristalsis has returned? Say it louder for those in the background.
Farts.
Farts. Are they tooting? Do they have vowel sounds? Are they having a VM? And then what are the similarities and differences between ulcerative colitis and Crohn's disease? Forgive me guys, I'm tired, I'm just sick. Reasons why we replace an NG tube and the steps of how to place an NG tube. They have a bowel obstruction. What else?
Risk for aspiration.
They're at a high risk for aspiration, so maybe I'm feeding them through it. What else?
No.
Go ahead.
Chemical or toxin that needs to come out of their stomach.
Yeah, some kind of overdose ingestion. You guys remember the steps? Do I need a consent for an NG tube? No. Believe it or not, it's like a Foley. You do not need a consent. Now this is the crazy part. Oh, I left that up there. I can't spell it either. What side should I lay a patient on to decrease GERD?
Right side.
This is the one and only time I'm gonna tell you to lay them on the right side. All the other times I tell you to lay them on the left side. GERD, it's lay them on the right side. How do we decrease a risk for a paralytic ileus post-op?
Hand rotation. Move them around.
Huh? Get them up. You saw it. Get them up. Get them up and moving. Human body's meant to be this, not this. Get them up, out of bed. Remember that 20-year-old who's gonna cry at me? I don't want to. Get up. Tough love. Symptoms of chronic cholecystitis. Don't just, I want you guys to do a deep dive on this stuff. I don't want you just going over what we're talking about in class. All right, you know how to look stuff up in ATI, in your med surg? Yes, no, maybe? You go to the e-book, you go to the little question mark up there, type in cholecystitis, hit the, what is it, a magnifying glass symbol, boop, it'll take you to everything about cholecystitis you ever wanted to know. Okay? What does the elevated bun point to? What does an elevated creatinine point to? Kidney function, good. What does a urine-specific gravity point to? Hydration and... You're close. You're almost there. Whether the antibiotics are working or not. Alright, you have a grandma who just had a cystoscopy. What's a cystoscopy? They're gonna what? Talk to me like I'm blonde, what is it? Huh? Cystoscopy. Look it up.
You look inside the cyst?
No,
Inside the sap?
you're close. Cystoscopy. It's the direct visualization of the bladder. So I'm gonna take that oscopy tool, and I'm gonna put it up your urethra, and I'm gonna look inside your bladder. What do you think some of the post-procedure teaching should be? What do I need to tell my patient about? Yeah, it's gonna be pink tinged. That's normal. You just pissed off that urethra. If it turns bright red, is that a problem? Is it gonna burn when I pee? That's normal. That's a known outcome. What do the albumin labs point to? Protein and nutrition, good. Alright. Blood transfusion. Labs associated with it. Steps of how to give it. What are some of the rules surrounding it? Y'all better say 2 nurses, normal saline, or I'm just gonna cry.
Will you repeat what you just said?
2 nurses, normal
2
saline.
nurses, normal saline only. What's the other rule? Can I go get a coffee once I start it? What do I have to do? 15 minutes. You pull out that lecture stuff I gave you. Go back to those slides. Risks associated with it. Now, you got a mom and dad who have a 7-year-old who just got diagnosed with sickle cell anemia. What do I need to teach mom and dad? How to take care of the 7-year-old? What am I afraid of? Yeah, symptoms of what? What do we call it when it gets really bad? You're almost there. Sickle cell crisis. Sickle cell crisis. How does the healthy 7-year-old suddenly go into sickle cell crisis? What causes it?
Dehydration.
What's the word we call when we lump all those problems together? Triggers. Remember the triggers? Get out
Stress.
your notes and look up the triggers for sickle cell crisis. Mom and dad need to know those. What's an easy trigger for mom and dad to fix? Besides elevation and altitude. What else?
Stressors.
Allergies?
Alcohol.
Well, that's this.
Sodium?
Water. Drink. Gaining. Push fluids on little monkey butts. 7-year-olds run around 900 miles an hour, don't they? Especially what season are we in?
Spring?
Spring to summer. If that little kid gets dehydrated, what's gonna happen? It's gonna go right into a crisis. Okay? You remember the other triggers? Infection, trauma, stress, elevation. Don't let them get triggered. It's just like asthma. When you got a little kid who's got asthma, you gotta teach mom and dad the triggers. Alright, differences between. This also means the symptoms and the causes. Folic acid deficiency, pernicious anemia, iron deficiency anemia, and sickle cell anemia. What's it look like? What's it caused by? How do I fix it? What's a clear liquid diet?
Anything that you can eat or seafood.
Add this to your repertoire, because according to ATI, grape juice and cranberry juice
Yes.
are also on the clear liquid diet. I just found that.
With chicken broccoli?
Clear
Watered
liquid.
down, yeah. If it's got
Clear
dumplings in it
liquid.
and veggies, the answer is no.
Isn't coffee part of it too?
And that coffee, as long as it doesn't have cream and sugar in it,
Yeah.
Coffees? But you can't.
according to ATI.
So we just don't use ATI then?
No, you do use ATI.
All right.
Alright, you got a patient who wants to go AMA. What's AMA mean? Yeah, they have the constitutional right to be an idiot. There's one problem, he just got his lab values back, and his potassium, oh wait a minute, no, that's wrong, that's the wrong person. His INR is 7.2. Now what am I gonna do? Say it louder for those in the back.
Explain the risks of leaving.
What's his risk? Spontaneous bleeding, right? But you gotta teach them the risks. They still have a constitutional right to be an idiot. Patient's got a lab of a K of 6.8. First thing you're gonna do, priority action. Is that a normal K?
No, it's fine.
Too high, isn't it? What am I worried about? The heart. How do I know there's something going on in his heart? You get an EKG. You get a 12 lead and you put him on a heart monitor. Right now. And PTs. Huh? EKG is the priority. I wanna know what the hell's going on in his heart. Cause my lows, my extra glasses don't work. Alright? How am I gonna treat hyponatremia? Hyponatremia.
Salt.
I can increase their salt intake. What else can I do? Son, you were there. What kind of fluids? Yeah.
Is 2%?
If it's low enough, you do the 3%. But what's the risk of 3%?
Seizures?
Seizures. So you gotta do what?
Precaution.
Seizure precautions, and you better infuse it slowly. Risks associated with high NG tube output. Doctor said place an NG tube, you come around 30 minutes later, he's already put out 2 liters.
Fluid imbalance.
Dehydration, and
Aspiration.
if the fluids are going out, what else is going out?
Electrolytes. That's right.
What's a positive occult blood mean? Okay, yeah, you told me there's blood in the stool. Where's the blood coming from? Somewhere in the gut. Alright? That's right. If you get frank red blood in the stool, it's in the colon. If it's black tarry stools, black like the color of your britches, that means it's from higher up in the intestine. What's docosate sodium?
Stool softener.
Who gets it?
After surgery.
Everybody.
You said everybody, like literally?
It's everybody who's on a pain medication. Everybody who's post-op. Don't make me famous. Cirrhosis, who gets it? And,
Hepatitis.
thank you. I was gonna say, I didn't teach you that much about alcohol, but I sure did teach you a little bit about hepatitis, right? If your liver enzymes are messed up, I think I put some on the board over there. Amylase, lipase, AST. What am I at risk for? No, I got hepatitis. Hepatitis gave me my messed up labs.
Pancreas damage.
I'm at risk for bleeding. Bleeding. What are we gonna do about painful IVs? Start a new one. Anybody remember heparin bridge therapy? Going back a page, because y'all messed it up on the last test. Well, I gave it to you again, because damn it, you're gonna learn it. What's this mean? Stable range, close. Therapeutic range. Okay, I'm gonna draw it on the board, just to remind you. Patient comes in, severe shortness of breath, leg pain, tachycardia, he's diaphoretic, he's pale, he has a sense of impending doom. And when you ask him what's been going on in his life, he tells you he just got off a plane flying in from Scotland. And his leg hurts. What's he got? DVT that did what?
Broke off.
Broke off and went where?
Heart.
Into the lungs. This guy's got a PE. Doctor says, whoa, put him on a heparin drip real quick.
That's what I meant when I was talking about, if you.
IV push. He gets him up here, and now we give him an infusion to stay in that range. That's the heparin. Okay? But Mr. Smith cannot go home on heparin, can he?
No.
What can he go home on? No, forget
Warfarin.
Warfarin, that's what I wanted. Yes, I wanted to make sure this was a dry erase marker. I don't want to do what Dr. Von Hugh did last year. So, warfarin takes forever to get up here. So, I love watching you draw that. Thank you. Y'all need to learn that. Heparin bridge therapy, you're going to see it so much of that. Alright, we give the infusion, we give the bolus by weight to get them up here, and then we continue them on the infusion. And then like 1 or 2 days later, the doctor will start the Coumadin therapy. And we're checking both sets of labs for the Coumadin and the heparin. There. I want you to look up hydroxyzine. Who gets it? What's it good for? Elements of consent. We already talked about him, didn't we? Yes, no, maybe?
Yep.
Is it just like sterile procedure?
So cabbage, and I start bleeding out. They don't need to wake me up to get me to sign something else so they can give me 6 units of blood. Does that make sense? Does that help?
So always get consent, like, so, okay, my other question, so like if they were gonna go under procedure, you would just get, I'm sorry, you would just get a consent for like blood transfusion, just
The
in
doctor
case.
will, the
Okay.
doctor will.
So,
There's a spot on the consent form that they can just initial it, add blood transfusion. PRN, emergent blood transfusion. Y'all know what PRN means, right? As needed, I need it right now, go get a blood transfusion. Yeah, don't wake me up to give me consent. That's goofy. So if I'm strung out on pain medicines, can I sign a consent? Yeah, they're all, they can't make a good decision. All right, heparin, bridge, hydroxyzine, element of consent. What's diaphragmatic breathing? How do I teach what is diaphragmatic breathing? How do I teach it?
It's a relaxation skill.
Deep breathing. Look at it. What else am I gonna do? I'm gonna watch for signs and symptoms of infection and bleeding, right? Am I gonna manage the drains?
Yes.
All right. Here's something funky. I just threw it out there for the hell of it. Hyperuricemia.
Yeah.
Close, look it up. What's it caused by, what's the symptom? Hyperuricemia.
Gout, it's a elevated uric acid in the blood,
Uh-huh.
and signs and symptoms would be severe pain in the joints, joint stiffening, difficulty moving the joints, redness or swelling, misshapen joints.
And what's it caused by?
Uric acid.
One medicine.
No.
That's how you treat it. That's how you treat it. No, that's still treatment. What's the medicine that causes this if you get too much of it? Lasix. Too much Lasix can induce this. I figured while we were messing around with electrolytes and we're talking about fluid movement, I was gonna teach you, if you give too much IV Lasix, you can cause this. What's the other side effect if I push IV Lasix too fast?
Ringing in the ears.
What's the 10-cent word for ringing in my ears?
Tinnitus.
Tinnitus. The reason I get stupid crazy about nurses pushing IV Lasix too fast. By the way, what's the rule on how fast is too fast?
Listen to.
Write this down, my darling. It's 10 milligrams per minute. Lasix. 10 milligrams per minute. Yeah, so if you got a 40 milligram push, you're gonna be sitting there. How's it going? How's it going? Anything good on TV? You doing okay?
On the bed.
You just sit there and you do it slowly. I can't tell you how many patients I had bounce back from another facility with a new symptom from their congestive heart failure. Guess what they were bitching about? Tinnitus.
Isn't that a huge symptom for COVID too, or like long term?
Well, I don't know.
I don't
I'm just
know.
thinking of the tinnitus and the Lasix right now. All I know is they all came back bitching about ringing in the ears, and all I wanted to do was the nurses. Because they just went whoop. That tinnitus never goes away. It's forever. Yes, sir.
Is that also the ototoxicity? Is that what it? Okay.
That's the symptom of the ototoxicity. Good. Very good. All right. Uh-oh. Symptoms of blood loss. I got shot in the belly, my hemoglobin's all over the floor. What do I look like?
Pale.
Jump fatigue. About pass the F out. Pale. What's my heart gonna do? Why? Yeah, I ain't got nothing in the pipe, so my heart's like, ah! What's my respiration rate? Extremely high. Am I gonna be diaphoretic? Yes. Am I gonna have a change in LOC?
Yeah.
Yes, very good. Types of blood products and why we give them. That's straight from the slides from last week, darlings. Types of blood products and why we give them. Who gets platelets?
People having trouble.
Thin blood.
Risk of bleeding?
Okay, well, let's do an easy one. Who gets whole blood? This is the kind of stuff you guys need to be able to apply.
Strong immunity.
Oh, whole blood, packed red blood cells.
Sickle cell, right?
Sickle cell, post-ops, trauma patients, anemia, if it's bad enough. Who would get platelets? What do we call it when somebody's platelets are in number of the labs in the toilet? Say.
Cytopenia.
Thrombocytopenia. That patient would need platelets. What kind of risks are they at?
Spontaneous bleeding.
Guessing. You're guessing.
Not clotting enough,
They're not clotting enough, so what am I at risk for?
bleeding out.
Thank you. They're on bleeding precautions. I'm gonna drag this out of here. Anybody ever seen a PCA pump? What is that?
Patient controlled analgesic.
Patient controlled analgesic. What's the first word?
Patient.
Patient. Who's in charge of that button?
The
Patient.
That means no nurses, no doctors, no spouses, and no kids.
I would push my mom's because she wouldn't push it. I'm like, girl, here's the thing. It's here.
You can hand it to her. You can hand
You know what
it
she
to
would say?
them.
I don't want to get addicted to it. I'm like,
Okay,
push.
here's my-
She looks at the baby control.
Dang.
All right, here's how you fix that. You ready? You're not gonna be on that medicine long enough to get addicted to it. That's your answer. No, that is your
She
answer.
would be, because then she was already dying, so then she would be like, oh, I'm gonna die tomorrow. She would have thought the worst.
Why was she on the PCA?
Because she was a cancer patient, so
Okay.
she was on a PCA pump because the tumors were like, pushing out.
And again, when I was talking to when I was a hospice nurse, I'm like, sugar, you can have anything, goddamn thing you want. You're on a seafood diet, you're hungry, you eat seafood, you can have it. Here. You're on a seafood diet, knock yourselves out, as long as you didn't get stupid. You know, I tell them, you know.
Oh, my mom got stupid at the end. We went to Walmart.
I know that.